Welcome back. February is National Heart Month. Heart disease is the #1 killer of men and women in the U.S. So here to share more about its importance, we have Dr. Sheldon Freeberg. Good morning.
Good morning, doctor.
Hey, good morning. Thanks for having me.
Well, we're happy to.
Yeah, we're excited about Heart Month. You know, it's really to bring awareness to cardiovascular disease. A lot of people present with their initial presentation of heart disease with a heart attack, and so we try to find ways to prevent heart attacks and screen appropriate people. And we're doing that very well here in Tyler, Texas. So we serve a big community, and we've been very excited about it.
That's great.
So, well, obviously, I think genetics, from what I understand about it, plays a part. Diet, maybe address one or both of those.
Right.
That's right. Yeah. So East Texas, known for its chicken fried steak.
Yeah, I love it.
You know, there's a lot of cardiologists in Tyler for good reason, and so certainly diet risk factors like family history, tobacco use, all those things that you can't change your genetics, but you can certainly change your diet and your weights and some of those bad habits. So,
right. So how often do you recommend getting screened then?
So screening, really we just, most of the time you go to a primary care physician and they'll help guide and assess your risk of developing premature heart disease. But certainly once you're over the age of 50, if you've never seen a physician, we'd encourage you to go. And if you have a strong family history, probably a little sooner.
Right.
So, and if you're getting out and exercises and enjoying the East Texas weather, you're noticing a little shortness of breath or chest pain or tightness, so that certainly can be a warning sign that there might be a problem with your heart.
Right.
What are some ways that you can assess that? Obviously, think about a blood test, but other imaging that you all utilize now?
Right. So when we're trying to screen for blockages, we certainly go by the history if there's any symptoms, and then we would do stress tests, whether that's a treadmill test or a nuclear test, to see if there's any blockage or possible blockage that we can detect. And those are fairly accurate tests. And so the definitive way would be to do what's called an angiogram or heart cath,
right,
where we would go and look at the arteries and see if there's any severe blockage.
Right.
So.
And that's the main way to prevent it then?
Well, certainly knowing a diagnosis will help you, but preventing, again, it just goes to a heart-healthy lifestyle, and that really holds true as you get older and gets you into the 90s.
There you go. So. Which you do want to stick around for, at least.
Yeah, definitely, yeah.
Well, and I know that you hear from exercise professionals and maybe some physicians about exercise. I know the cardio, you hear about strength training, of course, for the,
right,
I guess, the muscle and bones, but the importance of keeping, as I say, the ticker going.
Right.
Maybe address the importance of cardiovascular exercise.
Sure. So cardiovascular, the American Heart Association recommends 20 to 25 minutes of some, aerobic exercise. Not so much the weightlifting, heavy bench pressing, and that kind of thing. It's primarily to get your heart rate up, and if you can do that for 20 to 25 minutes, it's really all you need to do. 5 to 7 times a week would be great. But no, you certainly don't need to go and force yourself to do a marathon. But if you could just, crunch in 20 to 25 minutes of just a brisk walk or getting on a treadmill, just simple things like that really will pay off in the end.
Definitely. So really, it's all about diet and exercise.
Diet and exercise, avoiding chicken fried steak, like we're talking about, and the gravy.
Oh, you got to indulge sometimes, though. Oh, that's funny. Well, thank you so much for joining us.
Oh, no problem. Yeah, thank you very much.
Thank you. Coming up next.